So I'm really lucky here today to be joined by Dr. Andrew Bagg. He's one of the partners at Allergy and Asthma Specialist. A big part of spending time with Dr. Bagg is just discussing how we have a multidisciplinary approach to our management. We see a lot of patients from nasal airway and breathing disorders, and we are able to correct their septum or their valves, or in some cases even do sinus procedures. However, in a lot of cases, there's an inflammatory process. We refer directly to the expert. So while we'll do everything we can to improve the airway, in some cases we can make our patients 80% better, but to get them the rest of the way, we rely on Dr. Bagg. It's nice to have a partner locally who can help us with those patients.
A lot of patients have allergies, very common. Sometimes the problem is anatomical, sometimes the problem is due to allergy. We give allergen immunotherapy, which is now available in shots, drops, and tablets. This is a way to build up a tolerance or immunity to the allergens, so you don't react to the allergens that you're allergic to, and it can last for a long time.
And it's very customized, and at least in our practice, we try to customize it based on what the patient desires.
Yeah, it definitely works both ways. We have patients who do allergen immunotherapy first, and they don't get good enough benefit for it, or only helps them, halfway, and then we kind of send them to you to finish the rest of the job. There are patients who do not have allergies.
Mm-hmm.
Sometimes we look into their immune system, because I'm also an immunologist, so we can check their immune system for immune deficiency, and sometimes that can be the cause of recurrent sinus infections, and it's not allergy or an anatomical problem. So that's more rare.
And I'm in total agreement with that. I mean, I think a lot of times we follow the protocols. We use imaging, we do testing, we do nasal endoscopy, camera examinations to evaluate the anatomy, but even after all that, sometimes there can be some underlying systemic problem, and so that's why I think having specialists like Dr. Bagg in the community is so critical.